Good morning to all. I am Nalini, working as an assistant professor from Sri Ramachandra Faculty of Nursing, Chennai, India. And I thank the organizer for giving me an opportunity to present my research topic. So to introduce the topic, population aging is poised to become one of the most significant social transformation of the 21st century with implication for nearly all the sectors. By 2015, 1 in 4 person living in Europe and North America could be age over 65 years, and the number of persons age 80 years and over is projected to triple from 143 million in 2019 to 426 million in 2050. When you see the statistics in India, there are nearly 104 million people or more are elderly, and among them, 53 million are female and 51 million are male. The number of elderly persons is expected to rise 173 million by 2026. And according to World Health Organization's report 2020, depression is more underdiagnosed and undertreated in primary care setting, and also anxiety in older is very common, and it causes a lot of stress on elderly people. A need for the study, the prevalence of geriatric depression is about 23%. When you see the gender, men are like men, and the incidence is about 15.4%, and women is having 31.2% depression. And when you see the chronic anxiety, it is deleterious to the physiological and cognitive health of older adult, and it's very commonly leads to cancer and other disorders and even dementia. Depression can cause great suffering and leads to impaired functioning in their day-to-day life, and they cannot able to do even small activities. Their concentration is totally disturbed, and they are very tired. This was stated by World Health Organization 2020. And according to Caring People Agency report in the year 2018, they stated that elderly individuals with generalized anxiety may experience uncontrollable worry, nervousness, tiring, and also they become often irritable because of that anxiety, and the quality of life will be totally disturbed. So since the elderly population is increasing, depression and anxiety are more common mental health problem among them, which should be taken care as a primary caretakers. So hence, with this motto, the researcher had taken up a study to evaluate the effectiveness of cognitive behavioral therapy on depression and anxiety among elderly residing at a selected old age home, Chennai, India. The objectives formulated were to assess the depression and anxiety among elderly between study and control group, to evaluate the effectiveness of CBT on depression and anxiety among elderly, and to correlate the relationship between depression and anxiety among elderly, and to associate the depression and anxiety among elderly with their selected demographic variables. The hypothesis stated was CBT has an impact on elderly depression and anxiety. These are the few operational definitions. Assumption: aging may increase physiological and psychological morbidity, and CBT sessions may help to improve the sense of well-being. Delimitation: only one post-assessment was done, and it is delimited to only elderly population residing at old age home. Review of literature: so many literatures were reviewed, and the studies related to depression, anxiety among elderly were included, and studies related to effect of cognitive behavior therapy on elderly were included. This is the conceptual framework which is based on health belief model was adopted for the study. And when you see the methodology, this is methodology, quasi-experimental, non-randomized design with a pre-test and post-test with control group was adopted. So here, as a first day one, assessment on depression and anxiety among elderly was done, and CBT was given for the elderly along with the routine care. And day 14th, we have done the assessment on depression and anxiety was done after the intervention. When you see CBT, the cognitive behavior therapy was conducted in 5 sessions for 3 days in the morning and evening with along routine care with the duration of 15 minutes each to the study group. It was conducted in a group which consists of 5 members, and it was performed by the elderly with the help of the researcher. A diary was distributed to the participants, and I asked them to write about their hard feelings and that they were not able to focus on the day-to-day practice. Then the investigators sat with the participants for 5 minutes to work out unwanted thought which have an impact on their cognitive aspects, memory aspects, attention, and intelligence, which will alter their lifestyles. Following that, a warm-up exercise was for 5 minutes, followed by diaphragmatic breathing exercise was taught to the elderly to relax themselves. Activities for 5 minutes like doing some puzzle work, incomplete pictures, and block designs, as the elderly prefer, they were engaged. Then a presentation was done for 5 minutes to motivate them, and all the positive affirmation, positive notes were presented. And education on scheduling the activities were taught for 5 minutes. Finally, after the session, feedback for 10 minutes was obtained from elderly people on their experience about cognitive behavior therapy session. Setting, it was conducted in Chennai. 2 old age home was selected, and population elderly residing at old age home. Sample who met the inclusion criteria were included as a sample for the study. And sample size, based on the power analysis and based on the review of the previous study, it was estimated to include 1 or 2 patients. So 51 in the study group and 51 in the control group were included. The samples were selected by non-probability purposive sampling technique. And criteria for sample selection: elderly who belong to both genders, elderly between the age group of 61 to 75, and who scored normal and mild level of depression, and who scored mild severity and moderate severity of anxiety, were included for the study. And elderly who are not willing to participate in the study, and who have sensory impairments, and who have altered consciousness and neurological disturbances, were excluded for the study. Description of tool. There are 3 sections. Section A, so we have assessed on demographic variables such as age, gender, education, marital status, residence, number of children, source of income, reason to stay in old age home, duration of stay at old age home, and any other comorbid illness. Section B consists of geriatric depression scale. It consists of 30 items. So total score is 30. Scoring and interpretation: if the score is 0 to 9, it is normal; 10 to 19 is mild depression; and 20 to 30 severe depression. According to inclusion criteria, we have taken the score between 0 to 19 for my study. And section C consists of Hamilton anxiety scale. And here the score, like less than 17 indicates mild severity, 18 to 24 mild to moderate severity, and 25 to 30 moderate to severe anxiety level, and 30 to 56 very severe anxiety. So for study, I have included 1 to 30 level of anxiety. Validity and reliability of the scale. Retest method was used to find out the reliability of the tool, which was 0.89 for Hamilton anxiety rating scale and 0.84 for geriatric depression scale. So data collection procedure. So the study was conducted among elderly residing at old age home at 2 important homes at Chennai, and ethical consent was obtained. Informed consent was obtained from the study participants, and samples were selected by non-probability sampling technique and who met the inclusion criteria. So they were divided into study group and control group. For study group, first on the day 1, assessment on the geriatric depression and anxiety was done using the standard scale, and then next same day itself, CBT was taught to the patients in 5 sessions for 3 days, and post-test was conducted on 14th day. For control group, pre-test all assessment of background variables, depression and anxiety was done, and they were only given the routine care, and post-test was done on 14th. Then the descriptive and inferential statistics were used to analyze the data and dissemination of research report. So here, descriptive and statistics and inferential statistics were used to analyze the data. So data analysis and interpretation. So this figure, which depicts the percentage distribution of age in years. So here, both in the study group and control group, majority of them were between the age group of 66 to 70 years. And when you see the number of children percentage distribution, here, many of them in the study group and control group have 2 children. When you see the reason for staying at old age home, many of the elderly were neglected, abandoned by the children. So it is about 53% in the study group and 84% in the control group. And the duration of stay, 6 to 10 years, were the most of them were staying in the old age home, both in the study group and control group. And this table depicts the level of depression among elderly in the study group and control group before and after cognitive behavior therapy. So when you see the assessment pre-test, okay, so 17 of them had a normal and 34 of them had mild depression, whereas in control group, 33 of elderly were having mild depression. And as per inclusion criteria, severe depression was excluded. And when you see the post-test, after the intervention, 38 of them become to normal and only 13 in the study group had mild depression, whereas in the control group, it was 35. The next table depicts the level of anxiety among elderly in the study group and control group before and after cognitive behavior therapy. So here, before intervention, the anxiety level was mild for 29 patients, elderly, and moderate severity was about 22. And after the intervention, the mild severity was 44 and moderate severity was 7. So whereas in the control group, moderate severity before the intervention was 28, and after the intervention, it was 26, and mild severity it was 25. So table 3, comparison between the mean score of depression and anxiety among elderly during pre-test and post-test in the study group. So here, so when you see the depression, comparison between depression in the mean difference between pre-test and post-test, it is statistically significant at P less than 0.001. And for anxiety also, it is about 8.82, which was statistically significant at P less than 0.01. Okay, so this shows that there is effectiveness of CBT found in depression and anxiety. Hence, the hypothesis which was stated was accepted. And next table is on comparison between the mean score of depression and anxiety among elderly during pre-test and post-test in the control group. So here, depression, here it was before the pre-test and post-test, it was in the control group, there is no significant relationship found for both anxiety and the depression. And table 5, comparison of pre-test and post-test mean and standard deviation of depression score among elderly. A comparison was made here for the study group and control group. The mean with the mean difference here, it was 0.42, which was not significant before the intervention, but after the intervention, there was a significant difference found with the 3.96 at a P less than 0.001. Next table is on comparison of pre-test and post-test mean and standard deviation of anxiety scores among elderly. Here also, in the pre-test, there is no significant relationship found between the study group and control group. But after the post-test, the anxiety level, here, there's a significant relationship was found with the t-value of 5.03, which was significant at P 0.001. So this shows that CBT found reduction in the anxiety and the hypothesis accepted. Next, to find out the correlation between depression and anxiety. So here, in the pre-test, in the study group, it was significant relationship was found both in the pre-test and post-test. For the control group, also we had significant relationship, but it was very less. So major findings of the study. So when you see the fourth objective, there was significant association found between depression and marital status, number of children, reasons for the stay at the old age home, and the place of residence during pre-test at P less than 0.005. When you see the association between anxiety and the demographic variables like age in years, marital status, reason for stay at old age home, and illness had a association during post test, and it was at P less than 0.005. So nursing implication. So nurses can be trained in the CBT, and they can implement in taking care of when they are taking care of elderly patients. They can use this therapy, and they can able to manage anxiety and depression, and somewhat they can relieve. In education, the nurse educator should teach. We can teach the student nurses regarding the benefit of CBT and the positive impact of CBT. And when they are taking care of the patients, they can implement these therapies in the clinical area. And students can also be encouraged to prepare various teaching materials on CBT to provide further information and knowledge to the people. In nursing administration, so nurse administrators should take up the responsibility to create awareness among nurses by conducting a lot of continuing nursing programs. nursing research. More number of research studies should be conducted under this topic. And mainly those are working for the nurses, those are working in the geriatric unit, and how they can also motivated to do a lot of research in CBT. Recommendation for further study, it can be done at various settings, and it can be also done as a true experimental study, and it can be done as for a different population. To conclude, so the depression and anxiety is reduced, and which was statistically proven. And here CBT is an effective intervention which reduces depression and anxiety, and it is it is non-invasive and safe to practice among elderly. So these are the few references. Thank you. Any queries?
Thank you so much for the presentation. Any questions?